orbital margin. We can see very easily from here which structures are making this socket. If we see from the superior wall, we will be discussing along four walls: the superior wall, the lateral wall, the medial wall, and the inferior wall. Supraorbital margin, infraorbital margin, and the lateral and medial margins. So if you can see from the supraorbital margin, it is simply made up of the frontal bone, shown in the green here, and that thing, the anatomically different thing that can be seen on its medial aspect is this. There may be a presence of a notch, or in case of some people, a foramen. Foramen will be the continuity of the bone will be intact, but there will be opening right here. So there will be a notch or a foramen that is known as supraorbital notch or foramen. So these are the features of the upper margin. When talking about the inferior margin is made up of two bones, as you can see from the color coding. Here, it is made up of the maxillary bone, shown by the purple here, and here it is made up of the zygomatic bone. It is made up of the zygomatic and maxillary bone. Zygomatic bone will be the strongest one in the whole of the orbit, and it usually survives when the other bones do not survive the fracture. Then there is the lateral wall and the medial wall. If we look at the lateral wall, it is made up of the frontal bone above and zygomatic bone below, and in between them there is a suture, the fronto-zygomatical suture. In the medial wall, there are two bones, the frontal bone above and the maxillary bone below. There is a little addition to these words. This particular part of the frontal bone that is coming down to meet the maxilla, that will be the maxillary process of the frontal bone, this part. And this part that is going up to meet the frontal, that will be frontal process of the maxillary bone. If you don't remember it, just mention the frontal bone and the maxillary bone and you will be fine. These are the orbits. Let's look at the walls. It is easy to think of an orbit as a tipped over pyramid. Usually the pyramid is like this. There is a base there and there are walls that are going to the apex like this. So if we tip it over like this, it will be something like this. Okay. So this is how the orbit is. This is the opening of the orbit and we look inside to the base. So let's make it a pyramid. Then we will discuss it walls. So this is the base of the pyramid. This is the base of the tipped over pyramid. This is the apex. So these are forming the walls. So we will be discussing the medial wall, the superior wall or roof, the lateral wall, and the inferior wall or the floor. So these will be the structures that we will be discussing. So let's look at it in this very image. Which structures are making which structure? Which wall? The superior wall, it is made up of the orbital plate of the frontal bone. The frontal bone makes it, if you don't remember the orbital, that's fine too. It is made up of orbital plate of the frontal bone. Above it, there will be the middle cranial fossa. A part of the roof is made up of the lesser wing of sphenoid. You can see right here. This is the part of the roof. This structure, this supraorbital fissure, labeled right here, and it is shown in the picture in this slit. This is the demarcating boundary between the floor above, the roof above, and the lateral wall. on the lateral aspect. So this is the roof of the orbit made up of the orbital process of the frontal bone and the lesser wing of sphenoid. Onto the floor. The floor is made up of two bones, rather three bones. On the medial aspect, there is the maxillary bone, as shown in the purple here. This whole area, it is made up of the maxillary bone. This is the floor. If you look inside like there, it is not very visible on this view, but if you look from above, you will be able to see the less part of the roof floor made up of the zygomatic bone. Then we are left with this small bone, not very visible in the first glance, this bone right here. It is a part of the palatine bone that is known as the orbital process, as is coming to the orbital plate. And this is the bone that we did discuss when talking about the sphenopalatine foramen. So there are three bones making the floor of the orbit. The major component will be the maxillary bone. On the lateral aspect, the lesser will be the zygomatic bone, and on the back, there will be a very small process of the orbital plate of the palatine bone. Then there is the lateral wall. From front to back, it is consisting of the zygomatic bone, shown in the blue here, and then there is the greater wing of sphenoid. This lateral wall is separated from the roof by this fissure, that is supraorbital fissure, and this lateral wall is separated from the floor by this fissure known as the infraorbital fissure. So it is separated from the two by supraorbital and infraorbital fissures, and it is made up of two bones, front to back, zygomatic and greater wing of sphenoid. That leaves us with the medial wall. The medial wall contains a large number of bones. If we go from front to back, you can see this is the margin of the orbit. So from this margin to here, there will be the part of the maxilla. There will be maxillary bone, frontal process of maxilla. Then we will see the bone that is shown in the blue here. This is the lacrimal bone. If we go back, the third bone will be the ethmoid bone. And if you go further back, it will be this bone, that is the body of the sphenoid bone. So these are the bones that are making the medial wall of the orbit. Front to back, there will be maxilla, then lacrimal bone, then ethmoid bone, and then the then the body of the sphenoid bone. A few bony features that can be visible if you look very closely. Here you can see a fossa. This fossa is housing the lacrimal sac, the part of the system that collects the tears and they send them to the nasal cavity. That is the lacrimal sac. It is placed right here in this groove, so this groove is known as lacrimal groove. Its anterior raised margin, anterior lacrimal crest, is the part of maxilla. Its posterior raised margin, the posterior lacrimal crest, is the part of the lacrimal bone. And of course, we will see the suture between them. Going back to the ethmoid bone, here in the picture, in the bright yellow, you are seeing through the bone the ethmoid sinuses that are present beyond this bone between the orbital cavity and the nasal cavity. In actual skull, if you shine a bright light, you do see them, and these are due to the fact that this part of the ethmoid bone is very thin. It is paper thin. It is called lamina paperacea, paper thin bone. And on the back, the body of the sphenoid bone that is present here, it majorly consists of this opening that is known as optic canal. Optic canal. So relations of the orbit. Overall, the orbit anteriorly, it is opening to the exterior. through the orbital margin, and it is only covered with eyelid. Posteriorly, there was the apex. Apex had the opening of the optic canal, and apex had the opening of superior orbital fissures. And the inferior orbital fissure is the most medial part. So the optic canal is opening into the middle cranial fossa, superior orbital fissure is opening into the middle cranial fossa, and this medial most part of the inferior orbital fissure is opening into the pterygopalatine fossa. And infratemporal fossa, we will discuss the lateral parts here. They are opening into the infratemporal fossa. We will go into that. Above the roof, the roof of the orbit is making the floor of the anterior cranial fossa. So if anything that penetrates this roof, it goes through the bone, through the meninges to the frontal lobe that is present in the anterior cranial fossa. Medially, there was nasal cavity, and in between the nasal cavity and the orbital cavity, there is a presence of ethmoid air sinuses. Below, there was maxillary sinus. You see the bone, zygomatic bone right here, and medially there is a maxillary bone. The maxillary bone from the inside is hollow, and here a cavity is present that is present all the way right here. So that cavity is known as maxillary sinus. It can be accessed from the lateral wall of the nose. It is related to the inferior wall of the orbit, and it is related to the superior aspect of the upper jaw teeth. So this is the maxillary sinus. We will be discussing it in more detail when we talked about the respiratory system. Orbital openings, the one we some of them we have seen, some we did not. Let's discuss them one by one. The orbital opening, the biggest of the opening is the obvious one, the orbital margin. This whole one, this is the orbital opening, main orbital opening. There are some structures, there are many structures that are exiting through this opening. For example, there is supraorbital artery with supraorbital vein. There is supratrochlear artery with supratrochlear vein and supratrochlear nerve. So there will be supraorbital and supratrochlear structures, artery, vein, and nerve. There will be structure exiting, artery exiting right here to the external of the nose. That will be known as dorsal nasal artery. It will be accompanied by a nerve that will exit along with it. That will be known as infratrochlear nerve. We will see them shortly, inshallah. And then there will be branches from the lacrimal nerve. So after supplying the lacrimal gland, it may come out and supply the lids outside. So these are the structures that are coming out from the orbital opening. Then there is supraorbital groove shown right here, supraorbital notch, supraorbital foramen, supraorbital groove. Depending upon the exact bony shape, it has a different names. This notch contains the artery, vein, and nerves of the same name. It will contain supraorbital artery, it will contain supraorbital vein, and it will contain supraorbital nerve. Then there is this opening, the nasolacrimal duct, nasolacrimal canal. It will house the nasolacrimal duct, and as the name indicates, the duct connects the lacrimal part with nasal part. It connects the lacrimal sac present in the fossa here with the nasal cavity. As we will discuss, it will open into the inferior nasal meatus. If we look at the back, there is presence of two fissures, this one and this one. The one that the slit that is going upwards and laterally, that is known as superior orbital fissure. It is present between the body and lesser wing of sphenoid and the greater wing of sphenoid, and it is opening back into the middle cranial fossa. A number of things enter from here, and most of them are nerves. That includes the nerves in a single line, in a single arrangement. Number 3, number 4, number 5, number 6. It consists of the oculomotor nerve. It does not enter independently or singly. The two divisions enter. The superior division of the oculomotor, the inferior division of oculomotor. Then there is the trochlear nerve. Then the two of the three parts of the trigeminal nerve enter here. The ophthalmic division, it's the one that actually does supply all of the structures in the sensory component of the orbit. And then there is a maxillary nerve that has entered the orbit after giving branches to the pterygopalatine fossa, and it then gives rise to two branches, that is zygomatical branch and then infraorbital nerve as a terminal branch. Talking about the first division of the trigeminal nerve, that is the ophthalmic division, it does not enter as itself. It breaks into three branches, the frontal, lacrimal, and nasociliary, and they enter independently into the orbit. So these branches are entering independently. Then we are left with veins. The veins that are present here are in the orbit. There is superior ophthalmic vein here, inferior ophthalmic vein here. The superior one will exit through the superior fissure and inferior one will exit through the inferior fissure. So in addition to the nerves we just discussed, the vein, the superior ophthalmic vein will exit the superior orbital fissure to go to the cavernous sinus on the back. Then there is inferior orbital fissure. Inferior orbital fissure, it is present between the greater wing of sphenoid and the zygomatic and maxillary bone. It enters into two places. If we look at medial aspect, it is going into the pterygopalatine fossa. And if we look at the lateral aspect, it is going to be opening into infratemporal fossa. So it is opening on two different areas depending upon its location, medially pterygopalatine fossa and laterally infratemporal fossa. Overall, which structures are passing through it? Basically, the maxillary nerve on its way from the pterygopalatine fossa, it enters into the orbit through this fissure. The maxillary nerve itself and its zygomatic branch, they enter independently to the orbit here. The zygomatic branch has already separated from the main maxillary nerve in the pterygopalatine fossa. As it come maxillary nerve come forward, it changes its name to the infraorbital nerve and it enters the infraorbital canal and exits from in the front of the cheek. That brings us to this foramen, the infraorbital canal. The infraorbital canal houses the artery, vein, and nerves of the same name. It houses the infraorbital nerve, infraorbital artery, and infraorbital vein. Then there are 3 or 4 more foramina that can be seen here. The foramina that are present at the junction of the medial wall and the roof, these are the anterior ethmoidal foramina and posterior ethmoidal foramina. They are usually present at the junction of the ethmoid bone and the frontal bone, and they contains the structure by the same name. Anterior ethmoidal foramen will contain the artery, vein, and nerve, the anterior ethmoidal artery, the anterior ethmoidal vein, and anterior ethmoidal vein nerve. And the same will be true for the posterior ethmoidal artery, vein, and nerve. On the lateral aspect, in the zygomatic bone, there are 2 openings. The one opening in the zygomatic bone, it will come and exits on the front of the cheek. That will be zygomatico-facial canal opening onto the zygomaticofacial foramen, and it will contain the structures of the same name, zygomaticofacial, artery, vein, and nerve. And then there will be a foramen, that the canal that will run to the back of and open into the temporal fossa. That will be known as zygomaticotemporal canal, and the structures that are exiting through it, the artery, vein, and nerve, they will come to the temporal fossa. Some of them will go to the surface of the temple and go and supply the scalp, especially the nerve, and they may come and wind around the zygomatic bone to come to the anterior aspect also. So these are all the foramina and the structures that are covered by them. Let's talk about the orbital fascia. The orbital canal itself, in addition to the vessels and nerves that are making it, it is filled with fat. But here in the white, this is a picture from